My colleague Shivarur spoke to world-renowned virologist Dr. Ian Likpin about how to deal with the coronavirus outbreak. Listen in to what you can do to keep yourself safe from the world's top virologist.
Dr. Likpin, thank you very much for giving us your time. At a time when it is the wisdom of people like you that is extremely valuable in the global fight against COVID-19 coronavirus. This is a very serious issue, so we very much value your time. My first question, Dr. Likpin, it's been 3 months since the outbreak actually began. Why, in your view, sir, is there still no clear picture on the actual scale of the coronavirus pandemic? Why is it so difficult to get a fix on the full scope of this outbreak?
Thank you, first of all, for the opportunity to speak with your audience. I really very much enjoy your paper, and I look forward to seeing you next couple of weeks. This virus is one of the most transmissible viruses that we've ever encountered as humankind. We don't know the full measure of people who've been infected. In part, this is because many people have very mild disease, and it's only those individuals who probably get a very large dose of the virus or who are otherwise compromised because of age or some other medical condition that shows signs of severe disease. So one of the ways in which we determine the full scope of infection is to use antibody tests. Antibody tests can give us evidence of previous infection even after the virus is gone. Once we complete those tests, we will know the full scope of people who've been infected with this virus.
Right.
My estimate is that when all is said and done, a large proportion of the world's population will have been infected. It may be even as much as seasonal flu.
Dr. Likpin, where are we in that fight? You say that when all is said and done, a large part of the world population might actually have been infected. It could be like the seasonal flu. But in your assessment, where are we in the current fight to achieving that point where it becomes something like the seasonal flu? Is the end anywhere in sight?
Well, I don't know that there will be an end for this particular virus. It may, like influenza or measles, become something that we live with, develop vaccines for. It could well be that this is back with us again next year. The difference is, I think by the time the next season rolls around, either in the northern hemisphere or the southern hemisphere for respiratory season, which would be your winter months, you will see that we will have a vaccine. So a vaccine is probably about a year away. On the other hand, we are making strides collectively through this international cooperation toward beginning to come up with solutions for people who have severe disease. I know that China is starting a large study of individuals using something called plasma therapy. This is blood that's been collected from people who have recovered. There are also some drugs that look promising, at least with other coronavirus infections. One of the things that I would encourage your readers to do, as you begin to have people who are known to be infected, who have recovered, they should volunteer to provide plasma so that you can begin to develop your own plasma banks and you can treat people until such time as we have other drugs that are available and vaccines. This is something that's very, very useful and is a good thing to do for humanity.
Dr. Likpin, and I can assure you that people in India's healthcare system will be tuning in right now to listening to your words because they've followed your work over the last 7 to 8 years as well very closely. So I can assure you that they're hanging on to everything that you're saying. Since you mentioned vaccines, Doctor, I wanted to ask you, you've been quoted as saying that the effort towards a vaccine right now is almost akin to an arms race. What exactly did you mean by that, sir?
We are fighting against this virus. My friend, the late Nobel laureate Josh Lederberg, said that the last enemy that humans have on the planet, other than ourselves, of course, is viruses. And they will take us out unless we're smarter than they are. So they are continually emerging and re-emerging and mutating and evolving and becoming capable of causing more havoc. So again, by working together, and this is where people need, I think, to focus. If you think you are ill, you need to isolate yourself. Protect your fellow citizens. If you have recovered from this virus and you can donate plasma safely, please do so. If you can promote research into cures and vaccines and other methods for diagnosing these and other infections, please do so. We need everyone to work on this fight.
Dr. Likpin, you're a physician, you're a doctor, and you're a scientist. So you've looked at the effects on human beings, and you also, conduct research into the virus itself. The question, people want to know is this virus mutating as we speak? Is it becoming more deadly as we speak?
Viruses are always evolving. They're always mutating, adapting to their environment.
Yes.
We don't know whether or not this virus is going to become capable of causing more disease or less disease. It really could go either way. There is no evolutionary advantage to becoming more dangerous. The only thing that's important from a genetic viewpoint is whether or not you're able to reproduce yourself.
Right.
And sometimes the lifestyle you select is to be less capable of causing disease. So we have viruses that cause severe disease and kill, like Ebola, and we have others like herpes viruses and rhinoviruses that don't.
Right.
So there are many different niches for viruses. We don't think this one is yet settled on its niche.
You've worked consistently in China, Dr. Likpin, since 2003, since the SARS outbreak. You were an advisor there as well. How is the coronavirus? I mean, if you needed to explain this to, a layperson, how is the coronavirus really different from SARS and the common seasonal flu?
Well, this virus is capable of causing disease in people that ranges from very, very mild to no symptoms to very severe symptoms. One of the things that's characteristic about it, however, is that it is extraordinarily transmissible.
Yes.
We think, for example, so the only cases that we're really aware of thus far are those people who present with severe disease or who have a PCR test that reveals its presence. There are many, many more people. I would estimate that probably 1% of people have any sort of severe disease, and the fatality rate is probably going to be ultimately around 0.1%. Similar to what we have with seasonal influenza. Seasonal influenza infects up to a third of the world's population.
Yes.
Every single year. So this may be similar. It is spread by respiratory droplets that you convey to your face, to your eyes, to your nose, to your mouth when you don't wash your hands often enough. In addition, people can cough on you, and the distance that seems to be important is somewhere between 1 and 2 meters. If you're more than 2 meters away from someone who is coughing or sneezing, the chances that you're going to become infected are dramatically lower. But this is why we are recommending for many people who would otherwise hold festivals and so forth this time of year, that this is not the right time.
Okay, this is not the right time. That is, in fact, something that's very high on people's minds, because all manner of events, congregations, as you might have heard, Dr. Likpin, have been cancelled here in India as well. Another thing, since we're talking about India, it's been a week of panic with with this sudden spurt of cases leading to all manner of theories. One of them being that the onset of summer, the summer season, will actually see the virus recede in effectiveness. Is there any truth in that, sir?
Well, we predict that it probably will lessen. Well, it's hard to say, but you can make the argument that as people spend more time out of doors, whether not in close proximity to one another, that the ability of the virus to spread will be reduced. In addition, as droplets get heavier, you have more humidity in the air.
Yes.
They also travel less far. On the other hand, this is a new virus. We have no experience with it. So we're extrapolating from what we know about MERS, and which appeared, in the latter part of the 2010s.
Yes.
And this one, right, which in SARS in 2003. So people are still not even sure about the role of masks, versus gloves, versus caps, versus gowns. All kinds of things remain to be seen. Earlier this month, actually last week, I did an interview for a magazine here in New York where I said, I talked about what I called subway condoms.
Yes.
But the fact is, when you get onto a public conveyance and you're touching a handle or something that hundreds of other people have touched, you are running the risk of bacterial infections, viral infections, and so forth. So we encourage people to wear gloves. We think this is safer, at least for them. But then, of course, whatever you have in your glove gets carried to the next person.
Yeah.
But selfishly speaking, if you can avoid touching certain types of surfaces, you are much better off. You are safer.
Now, I'm glad you brought up the issue of the subway condoms, because my next question is really about that. Because things like asking people to avoid touching surfaces has led to, an unusual sort of thing here in India, Dr. Likpin. Like, there's been panic purchases of things like hand sanitizers and gloves and masks of every kind. People are hoarding these things. There are news reports that, things are being sold at a very high cost. How long can this virus actually stay on surfaces?
There is going to be a paper published soon that will describe some of this. So what I can only talk to you about is previous work
Yes.
that has been done with SARS. For the most part, most surfaces, certainly by 48 to 72 hours, you don't have any viable virus.
Right.
Other surfaces, like cardboard, it will be substantially less. So this work is being done by a team, at least one team that I know of, at the National Institutes of Health in the U.S., led by Vincent Munster.
Yes.
And I'm hoping he's going to be reporting those data soon. That said, if you get onto a public conveyance and you don't have something that you can use between you and the handle, whatever might be infected, you simply wrap your hand around a pole. That works as well. The most important thing is that if you're going to touch something, you want to make certain that you wash your hands.
Right.
Before you touch your face. People touch their faces hundreds of times a day, and you convey the virus from the surface to the mucous membranes of the mouth, the nose, or the eyes, where you can infect yourself. This is good policy always anyway. The other thing, this is less of an issue in India than it is elsewhere.
Yes.
When you greet people, particularly like we do, handshaking, we don't do it anymore. Kissing on both cheeks, probably not a great idea. So I think this will have an impact on our culture.
Apart from congregations, apart from the greetings, that you spoke about, Dr. Likpin, would you say there are any thumb rules for travelers as well? Because that's another question that a lot of people have. You visited China, you came back to New York, you self-quarantined yourself, you take precautions in virtually everything you actually do, including the subway condoms. What would you say to travelers who are wondering about how to go about necessary travel?
Well, you're not going to like what I have to tell you next. The only time that I ever get sick has been when I've been to India. And the last time was about 3 years ago when I went to Bhubaneswar, and I'm on my way to the airport, and we stop off at a monkey temple. And as I'm walking out of the exit, this monkey jumps on my back and sticks his fingers in my mouth. And everybody says, "Oh, that's such good luck." And I said, "No, I don't think so." And 24 hours later, I found out that indeed it was not good luck. Anyway, there are certain things that you cannot avoid when you travel. I think you need to be resilient. I think you need to make sure, again, that when you get up and use the washroom in a plane, that you make certain that you wash your hands when you come out so that you don't become infected. I wipe down surfaces as well. Many people feel that there's an advantage to wearing a mask when you're on the plane. If you want to do that, I think that's fine. There is a shortage of masks.
Right.
I think this is something that we need to address. Probably the best solution for that is to make more masks. But people who are buying up sanitizers and masks and selling them an inflated price are despicable. They're despicable people.
Yeah.
That's all I have to say.
Is there
this is one world.
Is there a disconnect, Dr. Likpin, between the global panic that we're seeing, even here in India over the coronavirus outbreak, and the actual facts on the ground? Or do you think that the panic is largely justified given what we know, or rather don't know about it?
Well, panic is never justified. Panic basically paralyzes you. I think caution and concern are the appropriate response. We don't think that this virus is going to have a mortality rate that's anywhere near as high as people think it is. So let me explain this for your audience. If the only people you know about
Yes.
as having infection with this virus, SARS-CoV-2, are those individuals who present with disease, and then you look at the mortality rate in those people, and you say it's 2% or it's 10%, in some places it's been as high as 10%, that gives you a misleading view because, number one, we know that there are many people who are infected who have no disease. And the evidence that we're beginning to see suggests that the mortality rate is going to be substantially less than 1%. That is terrible, I agree.
Yes.
But it's going to be more like influenza. Influenza kills anywhere between 250 and 600,000 people every single year. That said, people don't panic about influenza every year.
Yeah.
And I don't think they should panic about this either. I think they should protect themselves, and I think they should invest in the appropriate research that's necessary to bring about vaccines and drugs so that we can treat this infection.
Okay.
We will not lose to this infection if we do what we're supposed to do.
And let's hope that those words ring true. Less than a year, perhaps, till a vaccine is discovered, and hopefully panic wherever it's happening right now will recede and the world understands coronavirus just a little bit better. Dr. Likpin, always a pleasure. Thank you so much for sharing your thoughts with us here on India
I'll
Today.
see you on the 13th.
Yes, we will see you here in
Bye-bye.
India on the 13th. Thank you very much, Dr. Likpin, for joining.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.